I know some of you might have seen people pop their shoulders back in place on their own, but please, I cannot stress this enough, don't try this at home. Your shoulder joint is what we call a ball and socket joint, and it's designed for incredible mobility. It's the only free-hanging joint. Think about it. You can reach overhead, behind your back, and across your body. That's amazing range of motion. And it comes with a trade-off, stability. It's like having a golf ball sitting on a tee. The golf ball can move in all directions easily, but it's also much easier to knock off. That's your shoulder. When I see a patient who's tried to relocate their own shoulder, I often find additional damage that could have been prevented. Today, we're talking about shoulder dislocations, an injury that's far more common than you might think, and one that absolutely doesn't have to derail your active lifestyle if you know what you're dealing with. Here's something that might surprise you. Your shoulder is actually the most likely joint in your body to dislocate. And while that might sound scary, I want you to think of this episode as your roadmap to understanding, preventing, and recovering from shoulder dislocations like a champion. Let's start with why your shoulder is so vulnerable. Your shoulder joint is what we call a ball and socket joint, and it's designed for incredible mobility. It's the only free-hanging joint. Think about it. You can reach overhead, behind your back, and across your body. That's amazing range of motion. And it comes with a trade-off, stability. It's like having a golf ball sitting on a tee. The golf ball can move in all directions easily, but it's also much easier to knock off. That's your shoulder. There are three main types you need to know about. Not all shoulder dislocations are treated equally. Let me break down the three main types because understanding which one you're dealing with makes all the difference in treatment and your recovery. Anterior dislocations are about 97% of shoulder dislocations, meaning the ball of your shoulder joint moves forward. This typically happens during what I call the vulnerable position. Picture this, you're holding your arm out horizontally with your elbow bent at 90 degrees, like you're waving. Now imagine a force pushing your forearm backward while your upper arm stays put. That's the mechanism that causes most anterior dislocations. Young athletes playing contact sports and older adults from falls are the groups I see most often with this type. The telltale sign is that you'll have a visible bump or deformity in your shoulder, severe pain, and often the most comfortable position is holding your arm slightly away from your body. Posterior dislocations are much less common, only about 2 to 4% of cases, but they are tricky because they're often missed on initial x-rays. The shoulder dislocates backwards, and this can happen from seizures, electric shock, or high-energy trauma like a car accident. Here's what's concerning about posterior dislocations. They get misdiagnosed about 50% of the time on a standard x-ray. If you have shoulder pain and limited movement after trauma, but your initial x-ray looks normal, you may need additional imaging. Sometimes it's hard to identify on an axillary view of the x-ray, and you may need a CT scan. Inferior dislocation is the rarest form of dislocation, and if you see someone with this, their arm will be stuck above their head. This typically is from high-energy trauma and often comes with fractures and nerve damage. This one almost always requires surgery. So how do you know if you've dislocated your shoulder versus just bruised or strained it? Here are the key signs that should send you straight to the emergency room. First, a visible deformity. Your shoulder will lose that normal rounded appearance. You may see bumps where there shouldn't be bumps, or your shoulder might look flattened. Second, severe pain with complete inability to move your arm. I'm not talking about a little bit discomfort. I'm talking about pain that stops you in your tracks. Third, numbness in your arm. This could signal some nerve damage and needs immediate attention. And fourth, that feeling that your arm is stuck in an unusual position. Now, here's what I want you to understand about treatment. This is definitely not a DIY situation. I know some of you might have seen people pop their shoulders back in place on their own, but please, I cannot stress this enough, don't try this at home. Why? Well, because your shoulder dislocation frequently comes with hidden fractures, rotator cuff tears, labral tears, or nerve injuries. When I see a patient who's tried to relocate their own shoulder, I often find additional damage that could have been prevented. Professional treatment involves a careful examination, imaging to rule out those fractures, and appropriate sedation and pain relief, and then proper relocation techniques. After relocation, you'll typically need a period of immobilization followed by a structured rehabilitation program. You'll be given either a shoulder immobilizer or a sling. The mental game here is something we don't talk about enough, the psychological impact of shoulder injuries. When you dislocate your shoulder, especially if you're active, it doesn't just hurt your body, it can shake your confidence. You start to second guess your movements and you avoid activities that you love, and that fear can actually slow your recovery. The cycle works like this. Injury creates pain, pain creates fear, and fear creates avoidance. And avoidance is what leads to weakness and stiffness, which actually increases your risk of re-injury. Breaking this cycle requires both physical rehabilitation and mental resilience strategies. Your action plan. So what can you do to protect yourself and recover smart? Here's your practical toolkit. Prevention first. If you play contact sports, work on shoulder stability exercises. Focus on strengthening your rotator cuff muscles every day. These are the small but mighty muscles that keep your shoulder stable. Simple exercises like external and internal rotations with resistant bands can make a huge difference. Know when to seek help. Any shoulder injury with visible deformity, severe pain, or numbness needs immediate medical attention. Don't wait to try to walk it off. Recover right. If you do dislocate your shoulder, commit fully to your rehab program. I see too many patients who stop therapy as soon as they feel better, only to re-injure themselves months later. Your shoulder needs to not just be pain-free, but strong, stable, and with full range of motion. Building resilience. You want to work with professionals who understand that your goal isn't just to get back to where you were, it's to come back stronger and smarter. This means addressing any movement patterns or weaknesses that contribute to your injury in the first place. Here's the encouraging news. With proper treatment and rehab, most people with shoulder dislocations return to full activity. There is an increased risk of future dislocations, especially if your first one happens before the age of 25. But this doesn't mean you have to live in fear or give up the activities you love. Think of it this way. Your shoulder dislocation is giving you valuable information about your body. It's telling you where you need to build more strength, stability, or awareness. Surgery is like the 10th on the list for options. The first 9 are physical therapy. When you address these factors comprehensively, you often come back not just as good as before, but better. Oftentimes, my patients come to me and think they need surgery. This is a complete fallacy. The most important thing with shoulder dislocations after relocation is that period of rest and then getting back into a really good rehab program and then working on strengthening those rotator cuff muscles. We often say in orthopedics that probably 10th on the list is surgery and number 1 through 9 is physical therapy. Surgery is not always the answer, although in some people with multiple dislocations over years with some bone loss or a lot of damage to the tissues, surgery can be an option. But there is a long, long way to go and a lot of rehab to do before we even consider any kind of surgery. Thank you for tuning in to The Resilience Factor. If you're ready to build a stronger, longer-lasting body, make sure to subscribe and share this episode with someone who's ready to thrive. You can follow me at Dr. Pamela Mehta for more expert tips on strength, recovery, and orthopedic health. Until next time, stay strong, stay smart, and stay resilient.